The overhead lights are too bright. They're always too bright, glaring down like accusatory spotlights in some cosmic interrogation room. But that's not what's making the hand shake right now. It's the blood. Too much blood. The heart monitor screams, 140, 145, and somewhere in the back of the mind, a voice whispers the thing nobody wants to hear during surgery. This person is going to die. Right here, right now. And it's going to be your fault. Rewind. 6 minutes ago. Everything was fine. Textbook, even. The kind of surgery that gets finished early. The kind where you get to go home and actually sleep for once. The scalpel had made a clean incision. The retractors were in place. Even remembered to eat breakfast this morning. Well, yesterday morning. 17 hours ago. But who's counting? Scalpel. The word comes out calm, professional. Years of training compressed into muscle memory, the hand moving before the brain even processes the command. Press steel against skin, follow the map. Trust the anatomy. The cut is clean. Good. That's good. Except the body doesn't always read the textbooks, does it? Retractor. The assistant moves efficiently, everyone playing their part in this macabre theater. But they don't feel it the same way. They're not the one making the calls. They're not the one who'll have to walk out to that waiting room afterward and explain why someone's mother, someone's wife, someone's entire universe isn't coming home. Best not to think about that now. Focus on the anatomy. Except that vessel isn't where it should be, or is it? 17 hours into a shift and the brain starts playing tricks, seeing things that aren't there, or worse, not seeing things that are. The hands keep moving though. That's the thing about the body. It remembers even when the mind is screaming. Then it happens. Suction. Blood wells up in the cavity, dark and insistent. Too much. Way too much. The heart rate on the monitor climbs, 140, 120, 140, and there it is. That spike of adrenaline that cuts through the fog like a knife. This is bad. This is very bad. BP dropping, 90/60. Shit. That's the polite version. The internal monologue is significantly more colorful, a whole symphony of profanity cycling through every curse word learned in medical school and a few picked up during residency hell shifts. But externally, it's all clinical detachment. Hang another unit. Get me. The hands are shaking now, definitely shaking. Hopefully nobody notices. Probably everybody notices. There's a bleeder somewhere. Has to be. Find it. Find it before... I need more light here. Panic wants to flood the system, wants to shut everything down and run. But panic is a luxury, isn't it? Panic is for people who have the option to walk away. There's no walking away from this. There's a person on this table, draped in sterile blue, just a small window of exposed flesh, a battlefield reduced to 12 inches of vulnerable anatomy, a battlefield that's currently being lost. The eyes scan desperately. Where is it? Where the hell is it? Wait. Stop. Think. This is the moment. This is where doctors either earn their paycheck or become cautionary tales. The body is giving up, slowly shutting down, and there are exactly 30 seconds to figure out why and fix it before this becomes an entirely different kind of procedure. The kind that ends with paperwork and review boards and that weight that never quite goes away. The weight of carrying someone's death for the rest of your life. The heart monitor keeps climbing. 145, 150. Sweat is pouring down now, soaking through the surgical gown. Every muscle is screaming from standing in the same position for hours. The hands won't stop shaking. And there's so much blood. BP 85/55. Doctor?
I know. The voice comes out sharper than intended. Nobody deserves that. Everyone in this room is doing their job perfectly. It's not their fault. The eyes scan the surgical field again. There has to be something. Some sign, some clue, some... There. Is that... Yes. A tiny arterial branch, lacerated, hidden behind tissue, pumping blood into the abdominal cavity like the world's worst fountain. Almost invisible. So easy to miss. Would have been easy to miss. Clamp, now. The instrument snaps into the hand. The movement is automatic, precise despite the trembling. The clamp closes around the vessel. The bleeding stops. The heart monitor hesitates. 145, 138, 125, 115. Breathe. Remember to breathe. When did breathing become a manual process? Okay, we're good. Except nothing is good. The hands are still trembling, now from adrenaline dump rather than fear. The surgical gown is completely soaked through. Every muscle aches. The mind is simultaneously wired and exhausted, running on fumes and spite. But the patient is stable, for now. Let's ligate that and keep moving. The human body is a stupid, fragile thing. Soft tissue and blood vessels and organs that can fail for 1,000 different reasons. It's remarkable anyone survives at all, really. Evolution did a half-assed job, and now here we are, trying to patch up the mistakes with thread and titanium and sheer stubborn refusal to let death win this round. The closure begins, layer by layer, putting Humpty Dumpty back together again. Except Humpty Dumpty was an egg, and this is a person with a family in the waiting room and a life they want to get back to. No pressure. We're closing up. Final count? The nurse runs through the instrument count. Everything's accounted for, no surgical souvenirs left behind, small victories. The last suture goes in. The wound is closed. The patient is alive. For now. That's the kicker, isn't it? All this effort, all this stress, and there's no guarantee. Post-op complications, infections, embolisms, there are 100 ways this could still go wrong in the next 48 hours. Nice work, everyone. The voice sounds calm, professional. Nobody needs to know about the war that just happened. Nobody needs to know about the doubt, the fear, the moment where everything hung in the balance and could have tipped either way. The gloves come off. The gown comes off. The mask comes off. The face in the reflection looks tired, looks old. When did that happen? There's another surgery scheduled in 4 hours. A different patient, a different crisis, the same overhead lights, the same heart monitor, the same dance with mortality. But for now, for just this moment, someone lived. And that's going to have to be enough. The coffee in the break room tastes like dirt, but it's hot and caffeinated, and that's basically fine dining at this point. The body slumps into a chair that's seen better decades. Everything hurts. The phone buzzes. A text from the ICU. The patient from this morning, the routine case from 6 hours ago, coded 20 minutes ago. Didn't make it. The coffee suddenly tastes worse. That's the thing about this job. You can do everything right and they still die. You can catch the bleeder, stop the crisis, close them up perfectly, and then some random clot decides to travel to their brain at 3 a.m. when you're not even there. And you still carry it. You still wonder if there was something different you could have done, some decision made differently, some moment where you zigged instead of zagged. The phone goes back in the pocket. The coffee goes in the trash. Someone will have to tell that family, too. Probably already did. Probably used the same calm, professional voice, made it sound like these things just happen sometimes. Which they do. They just happen. The clock on the wall ticks forward. 3 hours and 42 minutes until the next surgery. The face in the bathroom mirror looks even more tired now. The hands wash automatically, scrubbing away blood that isn't even there anymore. Muscle memory, always muscle memory. In 3 hours and 42 minutes, someone else's life will be in these hands. And maybe this time will be different. Or maybe it won't. That's the real joke, isn't it? You save one, Lose one, save another, and the universe keeps score in ways you'll never understand. All those years of training, all that debt, all those sleepless nights, and in the end, sometimes the body just gives up, and there's not a damn thing anyone can do about it. The overhead lights in the hallway are too bright, too. And they're always too bright. And in 3 hours and 42 minutes, they'll be glaring down again, asking the same question they always ask. Are you good enough today? Are you fast enough? Are you lucky enough? Most days, the answer is yes. But not every day. Never every day. The coffee machine gurgles in the empty break room. Outside, an ambulance siren wails. Someone else's emergency. Someone else's crisis. Soon enough, it'll be time to scrub in again. The dance continues.